Okay, so today we're gonna go over the 12 cranial nerves. So first, cranial nerve is olfactory. Ask them if they have any breathing problems, if they have any deviated septums. You check for any drainage, any fractures. You have them occlude one nostril, close your eyes, give them something fragrant to smell. Do the same thing on the other side. Have them close their eyes, give them something fragrant to smell. If they're able to do that, then cranial nerve number 1, olfactory, is intact. Next is cranial nerve number 2, optic. You're checking sclera is white. You're checking the conjunctiva is pink and moist. You're checking for the pupil size. It should be equal on both sides. Also, you ask them if they wear any contacts or glasses, if they're nearsighted or farsighted. You have them read your badge. If they're able to read your badge and all that, then cranial nerve number 2, optic, is intact. Next is cranial nerve number 3, ocular motor. You are checking that the pupils are equal, round, reactive to light and accommodation. So you have them shine the light on the side. You're doing a pupil reflex test, so the pupil should constrict. Do the same thing on the side. The pupil pupil reflex should be brisk. Also, you shine their light in their eye. In one eye, both pupils should constrict simultaneously, so you have consensual eye movement. You are checking for accommodation, so you have them look at an object far away. People should dilate. Then you have them look at the object right in front of them. The pupil should dilate. The pupil should constrict. So when they look away, the pupil should dilate. When they look at the object in front of them, the pupil should constrict, and you have accommodation. Also, you are looking for convergence. You have them follow your pen, and then have them go cross-eyed. And you should have symmetrical bilateral eye movement. Next, you're checking for cranial nerves 3, 4, and 6. So ocular motor, then have them move their eyes laterally. That's abducens, ocular motor, abducens, ocular motor. Have them look down, and that's ocular motor, trochlear, ocular motor, trochlear. So cranial nerves 3, 4, and 6. Trochlear, ocular motor, trochlear, and abducens are intact. Next you have them close their eyes and touch their forehead, their chin, their cheeks, and if they're able to feel that, cranial nerve number 5, trigeminal, is intact. Next you have them puff their cheeks, raise their eyebrows, smile. If they're able to do that, cranial nerve number 7, facial, is intact. Next, you check their ears, make sure there's not any excess serum, that they palpate, make sure they're not swollen. Have them occlude an ear and whisper blueberry. Then on the other side, whisper, occlude their ear, and whisper another word, strawberry. If they're able to hear you, then cranial nerve number 8, acoustic, is intact. Next, you have them go ah and swallow. Able to do that, cranial nerve 9 and 10, glossopharyngeal and vagus, are intact. Next, you have them stick out their tongue, have them lift their tongue, touch their cheek to their tongue, move it. You're checking for cranial nerve number 12, hypoglossal is intact. Next, you're checking their cranial nerve number 11, accessory. So just palpate the skin, the shoulder of palpate the shoulders. Check the skin. Have them press down on their shoulders and have them lift against your hands. So you're checking for their strength of their trapezius and sternomastoid muscles. You're also checking for the range of motion of their head. So look straight is extension, back is hyperextension, chin to chest is flexion, ear to shoulder right flexion, ear to left shoulder left flexion, right rotation, left rotation, circumduction, and able to do that. Cranial nerve number 11, accessory, is intact.